Welcome to Ultimate Medical Academy screencast on modifiers, evaluation, and management. Your objectives is you will know which 3 modifiers are only used with evaluation and management, and how to use each of these modifiers. The 3 modifiers that go with evaluation and management are 24, 25, and 57. Let's go ahead and look at these modifiers. Now, modifier 24 is an unrelated evaluation and management service by the same physician during a postoperative period. Now, again, this is only used with E&M codes. You use this modifier to report services that were performed during a postoperative period but were unrelated to recovery from the surgical procedure. It is also added to indicate that the evaluation and management service was not part of the surgical package, but it was unrelated service. So let's look at an example. We have a male patient who had his tonsils taken out 3 days ago. He is coming in today for a follow-up on the tonsillectomy. The patient comes in, presents to the physician's office for a follow-up, but asks the physician to take a look at a mole he noticed on his neck that has changed color. Now, the postoperative visit is for the tonsillectomy. We would report that with code 99024. This is a no-charge code. Now, the evaluation of the mole is reported with code 99211 or 2 or 3 or 4 or 5, depending upon the documentation, but we add the 24 to that evaluation and management. Now, this is to indicate medically necessary evaluation and management service for something that was unrelated to the follow-up on the tonsillectomy 3 days ago. Because the mole is not part of the tonsils. And if we just sent in the code, the insurance company would deny your code, your claim, and you would have to revisit and resend with a corrected claim. Because they're going to say that it's all part. But with that 24, it says it's not part of that surgery. We would like to be paid. Now let's look at 25. Modifier 25 is a significant, separately identifiable E&M service by the same physician on the same day of the procedure or service. Now, again, this is only used with evaluation and management codes, and is to report an E&M service on the same day when another service or procedure is provided by that same physician on that patient. Now, if you do not add this 25, this modifier 25, to the additional E&M code for the service on the same day of a procedure, the third party is going to not allow the charge because they would think that, well, the patient came in for this, so this procedure is part of the evaluation and management, so we're not going to pay him. We have to indicate that it's totally separate and identifiable, that we had an evaluation and management, we also did a service, we want to get paid for both. Here's an example. A 72-year-old male is in for his yearly examination, which we would give him a code of 99397 because he's in for his yearly examination. And he's also 72 years of age. While there, the doctor asks the elderly patient if he has been in for his flu shot this year. Patient says no, and the doctor asks if he would like to take care of it now while he is here. The patient agrees, and the physician gives the patient a flu shot via the intranasal, or the flu vaccine via the intranasal. Now, is the flu part of your yearly exam? No. So we need to add the modifier to the 99397 to say this is visit, this is why they were in, this is their evaluation and management. We add that 25 to it, saying this is distinct and separate from the procedure, which the flu vaccine via nasal is 90672 and 90473. Again, if we do not apply that 25 to the E&M of the 99397, then the insurance company would not pay for the flu shot because it would be considered part of the evaluation and management. Let's move on to modifier 57. Now, modifier 57 is decision for surgery. Again, this is only reported with the E&M code to indicate that the day the decision to perform a major surgery was made. And it requests payment for the E&M service outside of the global package for a major procedure when the decision to perform the surgery was made during the E&M service. For example, patient is in to see the doctor, and by the end of the appointment they have decided that the patient should have surgery. Well, okay, we need part of our global package or our surgical package is preoperative, operative, intraoperative, and postoperative. Well, we need a day to know when we decide to make that surgery so we can go into that preoperative period. That's what this modifier 57 is. We would put the 57 on this appointment saying that this is when the decision was made to have the procedure. And it also gives the insurance company an idea of when to start the preoperative period for the surgery. Well, we have now gone over the 3 modifiers attached to the E&M service. I want to thank you all for choosing UMA, and please remember to attend your instructor's labs along with visiting the Academic Coaching Lab calendar for more information on modifiers. Thank you, and have a good day.